if you have neck pain, exactly at the base of the skull, right where the head meets the neck. You're in the right place because I'm going to teach you 3 techniques to relieve pain right in that area. And we're only going to need a small spoon like this one. Get one and join me during the video. I'm just going to turn around to position myself. There's the camera so we can be in a comfortable position. From here, I want you to start locating the muscles that should be right at the back from the base of the skull to the base of the neck. This whole area is full of deep muscles, especially here at the junction with the spine and the skull. For this, I want you to first take your spoon, start with your right hand, and from here I'm going to place the cable. Better here, so it bothers me less, and from here you do a sweep around all that cervical musculature. Pay close attention. I'm going to use the edge of my spoon, this one right here, to scrape all that surface, bring more blood, and relieve the muscles. You can use a little bit of oil, okay, so that spoon slides better and doesn't cause so much irritation on the skin. I'm gonna do it without anything, so we start right here. Underneath the ear, place that spoon parallel to the skin and gently go down that lateral musculature, which are the scalenes. Very, very nice to work with. We go up, we stick the edge of that spoon again, and gradually go down to the base of the neck. We move a little further, we stick that spoon again, and then we lower it to the base of the neck and repeat. Area of the nape, we go down to the base of the neck, up to where you can go up with the spoon as far as you want, really. But the hair starts to do exactly there, at the junction between the neck and the skull. So it's an easy reference point to find. Since it's harder on me, since I don't have any kind of hair. We grab there, we stick that spoon in, and we go down slowly to the base of the neck. We continue. Once we have covered all that muscle area at the back of the neck, we repeat the same thing again. From the opposite side, I start from the most lateral part, right below the ear, down to the neck. I move a little further. I'm going to cross over so you can see it better. I dig that spoon in and I go down with it to the base of the neck. I continue. I dig that spoon a little deeper. I keep going down to the base of the neck, and I continue, moving slightly further and digging the spoon down more. Down to the base of the neck a little more. I continue until I cover all the musculature, the entire neck in its posterior middle part. We don't do it, okay, because here we have the spinous processes of our cervical spine and it can become unpleasant. Next, we'll move sideways a bit. The head is worth giving more attention to the muscle package that is found all along the side of the neck, and we're going to insist a little more on the trapezius. We're going to start again from the base of the ear and continue, but this time, instead of stopping here, I want you to reach as far out as possible. Right here, you can see a peak or a bone that corresponds to the clavicle. We should reach that point. If you don't get there completely, it's okay, but that's the goal. Within the movement, we fix that spoon flat, we give it a little more intensity, we lateralize that neck well to work that trapezius muscle to the maximum. We go down until we get there. To the bone, we fix it again. Greater intensity, well, parallel to the skin level, we go down, and you see how little by little that skin becomes more and more reddish. We bring a little bit of inflammation, a little bit of blood, and it can be extremely pleasant to treat some muscle pains. We go down, we have 3. If you find it very unpleasant, it scrapes too much. We can use a little bit of oil to make it more pleasant. 4, last technique, nail spoon. I go down to the side, I return to the initial position, I lateralize towards the opposite side, always looking forward, remember. I will now demonstrate the same techniques from a slightly different angle for better visibility. Nail that spoon right below of my ear and I slide it sideways until I reach the lateral edge of my trapezius, right at the level of the clavicle. Nail. I go back down with greater intensity, more pressure on that spoon to deal with the muscle in more depth. Nail. And I go back down. We've done 3. We're going to do 2 last ones. Nail. I go back down. Last repetition or pass, I nail the spoon and go all the way down. We have treated the general musculature and focused more on traps. Now we will focus on the suboccipital musculature, which is our main target. To work with this spoon, for this we are going to use our edge of the spoon. Notice, I want you to use this part, just the edge or the tip of the handle, and I want you to apply a little pressure. Just behind the ear, if you feel with your finger, there is a very hard bone called the mastoid process. We call that the mastoid process, and right behind is when those suboccipital muscles start to originate. I'm going to see if I can turn this around so it bothers less. From here we place that spoon at the base level, right here for example. I support and it's very hard. And I want you to root a pressure in this transverse way that goes up to the middle area of the neck. Now we go back to nailing that spoon at the base level of the ear. Mastoid process. And from there I push, 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 push and work all that musculature. We're going to do 3 more. I support the spoon, constant pressure, and I take it to the center of the spine. The movement is small, but it's very intense. Give it depth because it can be extremely pleasant. 1 more nail and I slide to the midpoint. We can also work it from bottom to top, flexing the neck, exposing that suboccipital musculature. The more we extend, the more closed it is. The more we flex, the more open it is. And from here, use our spoon in the same way to work from bottom to top that musculature in a much more local way with a slightly more demanding technique. Working the entire area from the middle part to behind the ear with passes from bottom to top and always with a neck flexion in such a way that this lower cervical area is well exposed. We now try with the opposite side, okay? Let me change position a little bit to move the cable to this side. I take my spoon, let's remember that later point if the mic leaves it at the level of my ear, and from here to take that spoon, little by little, little by little, little by little to the center of the column. You'll notice that it starts to sink here due to less muscle. Let's go with the second. I push, I push, I push, I push, I push, I push to the middle. We're going to do 3 more. There I'm more centered. I push, I push, I push, I push. That's 3. I have 2 left. I push with that spoon. 4. Last repetition goes behind and reaches the middle level. And if I want to work more at the level of the suboccipitals, I can flex my head, bringing that chin towards the chest, and from here work with my spoon, that musculature. From below above, 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 from below above. Skin irritation in the affected area is normal and expected. You see that there is too much friction or it is very unpleasant for you, you can directly apply a little bit of cream to improve that sliding. And you spend about 30 seconds, a minute, working all that muscle area that is going to help you alleviate the symptoms. Once you have completed, you return to the original position and check a little bit what the sensations are. The truth is that I feel the back of my head much more relaxed. Next, we'll do a very good stretch. I'll leave this here. Now that we're done with the spoon, let's move on to the stretch. We have 3 sections: spoon massage, stretching, and finally a last strength or muscle work exercise. For this, we're going to position ourselves here facing forward so you can see it correctly. I want you to place one hand here at chin level and another hand here at the nape level. I'm gonna do it backwards so you can see it better, and another hand here at the nape level. What I want is for you to push the chin backwards, pay close attention. I push the chin backwards and with the nape hand pull upwards. It's as if we wanted our head to do this. My left hand pushes backwards, my right hand pushes upwards, and then I bend my head downwards. This is going to cause a stretch of all the suboccipital muscles, which is quite pleasant and gives very good results. Let's go for it. I push here with my back hand, pull up and look down, slowly, bringing that head flexion until I feel a stretch at the level of the suboccipital muscles. We're going to hold for 30 seconds. Let's go for it again. I push, bring that mouth up and look down, flexing, and hold the position. Very straight, very upright. Let's count 30 together. We have 5, 10, 15, 20, 25, and 30. Then We completely relax, return the head to its initial position. We can do a little bit of trapezius movement if it bothers me. And now we're going to see a small variant, okay? Also very interesting that focuses more on one side or the other. Basically, it's the same, okay? We pull that chin back, look back. From here, I take my hand, place it at the nape level, pull up to stretch that back part. I look down, and from here, look, what I'm gonna do is push my chin to the left. And what I'm going to notice is an extreme tightness on the left side of my neck, especially at the suboccipital level. We are in this position, the hands remain fixed, and my left hand pulls my skull outwards, producing a rotation, and there, exactly, I notice a significant stretch. I'll pause for 30 seconds without speaking to maintain the tension. You can play with your hands, lower, higher, rotating more, or moving further left. Try to find the exact angle where you feel the most tension, exactly at that posterior point, at the level of the neck. We've done 10, 20, and 30. We relax slowly, return the neck to its initial position, and we are going to do the same, okay? Except that now what are we going to do? Instead of pulling the head to the left, we are going to pull it to the right, so we are going to notice the tension on the right side. Okay, now I'm going to turn a little bit so you can see it better from both cameras. From here, I bring that chin back, I bring that nape up, chin very close to the neck, and from here what I'm going to do. Instead of going to the left, I go to the right, slowly. We're going to change hands so it looks better. I lie back, flex, head up from here, spin, 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 until I feel tightness on this edge on the right side of my neck. And from there, I hold the position for 30 seconds. We're at 10, 20. And 30. We relax, slowly return that head to the initial position, and we face the camera again. Pay close attention. We have done the following. Head back, chin. We turn to one side, and then we have turned to the other to work the muscles on both sides. We move our shoulders a little to relax in case any discomfort appears. And I'm sure you're already feeling some relief in your neck. We continue with another massage technique that I forgot earlier, and that is the ball. Basically, we have to approach the wall. There we are. Let's bring this camera a little closer with me. We have to approach the wall. Let's see there, perfect. And locate that exact junction point where both the skull and the neck are, that passage between head and cervical. Use that ball and place it exactly at that point, in that exact place. Let me show you with the opposite hand, right where I have the mic. Also, we leave that ball there. We approach at the level of the wall and support the head. Make sure it's not visible on camera. Let me adjust it a bit. We place that ball at the level of the wall, support the head, and let that head fall against the wall, so that the muscles relax through the pressure of that ball. By gradually pushing the head against the ball, it gets into the muscles and relaxes them through a deep massage technique. I suggest doing it on one side, just as I'm saying now, alright? So what? There I take my chin back to open up that back area more, and I support myself for about 30 to 60 seconds. Let's just do 30. So you can see, close your eyes and push your head back, okay? If I'm doing the exercise correctly, it's because I'm applying pressure. If I didn't apply pressure, the ball would fall. After 30 seconds, we switch sides. I locate my right side right there. Junction between skull and neck. I support my head to see that it looks perfect. And from there, I maintain a constant pressure. I turn downwards to open that posterior area, and from there, I hold. 30 seconds. We're at 10. 20. And 30, we relax, we drop the ball, and we're done with it. As promised, we've covered 3 fundamental pillars: spoon massage, ball massage, stretching, and exercises. Spoon and ball massage are the last strengthening exercises. It's a pillar. Exercise is the second one we're going to do now, and finally stretching, which is the one we've done in the middle. The double chin exercise, you've probably seen it before. I really like to do it, and it's an indispensable exercise for the health of your neck. To get into position, sit on a stool with your back against the wall, ensuring your neck and buttocks are touching the wall. The stool's backrest should not interfere with your positioning. From here, notice the importance of your chin. I want you to take it back and try to reduce this space here, right between your neck and the wall. Taking that position, taking that nape up, it's a bit like what we did before with the stretch. We're going to hold the position 1, 2, 3, 4, and 5. I relax, this chin goes forward, and I go back again, support, head, introduce, chin. I reduce this space that exists right here. 2, 3, 4, 5, relax. We have 2, let's go again. I push my head up. I reduce this space that we have here. 2, 3, 4, 5, relax. You should feel the workout in your neck and back as you are putting in significant effort. Deep back muscles at the spine. We'll do 7 more before ending the video so you can join me. 2, 3, 4, and 5, and relax. You can also hang a small towel here just to have a reference and be pressing something when you do the exercise. Let's go again. I push. Relax. We have 4 or 5. I push. I reduce this space. I keep the contraction. Relax. 6. I push. Relax. 7. We only have 3 left. I push. Relax. 8. I push. Nine, last repetition, I push. And 10, very good. What did you think? I feel my neck very different from how I started the routine or the 3 techniques. Thank you sincerely for watching the entire video. I hope you have joined me at home doing some of the exercises and that you can share it with anyone who has discomfort at the cervical level and who needs a little help to get ahead. Go ahead. I bid you farewell, thanking you sincerely once more for staying until the end. I hope to see you soon in another live broadcast next week. Bye, friends.